Can we trust Robert F. Kennedy Jr. on health and medical matters? I'm Chad Swanson. I'm an emergency physician, and I'm on a journey to understand and transform our health system. And I share daily videos that shares my steps along this journey. We live in a time when there is a tremendous amount of information, and there are people making conflicting claims all the time. And so I think an important skill that many or even most of us need to have is the ability to fairly rapidly discern whether someone is trustworthy or not regarding the way that they present scientific and medical information. So I've shared in other videos 5 considerations that I think are important. The first one is someone's credentials. So Kennedy was an environmental lawyer. So on the one hand, he's quite accomplished in a field that's well respected. On the other hand, he may or may not have had extensive background in the biomedical sciences. In any case, I don't put much weight on credentials. I do want to pause now and just comment about our own biases, especially when it comes to political candidates. We as human beings can be very tribal, so we can believe what people in our group, whether it be a political party or other group, we tend to believe and hold on to the beliefs of those that are in our group, even when there's evidence that is against that. So that's one tendency that I wanted to comment on. The second is the tendency to be, I call it sensationalist, but by that I mean we want to find either a quick fix or a pill that will fix something, or an explanation for something that's tragic, or a way forward that will save us, a person or a pill or a surgery or something else, or an explanation that will save us from something that's horrible. So I think we all have a tendency to be both tribal and sensationalist. And so whenever there's an organization or a candidate, it's helpful, I think, to pause and take a step back and think, how might my views about this subject be influenced by my loyalty to a certain political party or whatever the case may be. So I honestly didn't know much about Kennedy prior to looking into this. So I just spent an hour or two. I first went to his website, and it was actually kind of encouraging to see, he had a very bold vision of make America healthy again. I expected to see a lot about vaccines because I did know superficially of his concern about the safety of vaccines. But I found more about chronic diseases. And so there was a number of discussions about and videos about obesity and autoimmune diseases and autism and cancer and mental illness. There was a comment about the influence of corporations and big pharma. And that was all quite refreshing, and I actually was motivated and energized and loved it. As I dug a little deeper, I found a quote he said in one of his videos that, when I am president of the United States, I am going to end the chronic disease epidemic in this country. So one consideration as I consider who we can trust in science and medicine communication is whether the expert or so-called expert speaks in absolutes. So the claim that he could end the chronic disease epidemic in this country is preposterous, really. It's such a complex issue that is grounded in personal behavior and community and food, the food industry and pharmaceutical industry. To think that one person could come along and end that is, in my view, preposterous. So that gave me pause. But again, I was intrigued and puzzled by why I didn't see much about vaccines. So I did dig a little bit deeper and found the Children's Health Defense Foundation, I believe it is. This is a foundation that, I'm not even sure exactly what his role in is, but he's certainly a leading champion of this foundation, may have been a founder, I'm not sure. But I just started scrolling through to get a feel for the extent that that the claims are based on science. And I saw one article quoted over and over again, and here it is. It's by the authors Hooker and Miller in 2020. And the claim was that vaccinated children were much more likely, 2.18 times, more likely to have developmental delays, to have asthma. So you can see these charts that are quite prominent and really concerning if we take them at face value. So I pulled up that article, and I've got it. Let's see, where is it? The article's here. And as I reviewed the article, there were a number of limitations in the methodology. And so one, for example, was that in the population that was studied, 30%, as I recall, of the children were not vaccinated, whereas in the general population, I think only about 1.3% of the children were not vaccinated. And there were other issues with the way that the study was performed and the study size. And then I looked a little deeper as well into other studies that looked at the effect of vaccines on development and asthma and other conditions. And I found that this appeared to be a significant outlier. So there were a number of other studies, and I'll leave a link to those in the description. But as I recall, there were 10 or more studies that were much more rigorous and robust scientifically than the study that is quoted on this website, that showed no correlation or no increase in those other conditions. And so this is very concerning. So if someone that has the chance of playing a significant role in our government, I'm not sure what role Kennedy will ultimately end up playing, but is supporting their claims with one study that's an outlier, and there's not adequate communication about the entire number of studies that have been done on that topic, then that's not science. That's cherry picking a certain study to support your claim, as opposed to trying to find the truth from the balance of scientific studies. So I only spent a couple hours, but I think in the real world, we only have a couple hours to consider whether someone is trustworthy. And so I'm very concerned about how trustworthy Kennedy is in regards to scientific and medical studies. I'd love to know your thoughts. Thank you very much.